I'm Dr. Benjamin Busfield here in one of the operating rooms that I would work in to give you an example of how a surgery day would go. You would arrive at the hospital or surgery center. You would check in and be changed into a gown. You get an IV put in your arm for IV fluids and to give antibiotics or medications, and taken here into an operating room. You would lay here on this table. You would be safety strapped in place, and you would receive your medication to fall asleep by the anesthesiologist. Typically in the operating room, there's a team of people caring for you. Myself as a surgeon, the anesthesiologist, usually a circulating nurse, and a scrub tech, all of which are working together to have the necessary equipment to care for the patient. I'll be talking today about the arthroscope. Arthroscopy, which is a main tenet of surgery in orthopedics and specifically sports medicine, is a very important tool for surgery. This is an arthroscope. Actually, it's the arthroscopic sheath. This is the sheath that the arthroscope goes into. We make a small incision in the body part of interest, usually a joint. We would place this through the incision into the joint, remove the sheath, at which time we place in the arthroscope. This is the actual arthroscope, and when it's in the sheath into the body, it's about the size of a number 2 pencil for reference point. In the old days, when the arthroscope was introduced, you'd have to put your eye and look into the camera to do the surgery. It would be difficult to do visualization and to maintain sterility, and also your team can't see what you're doing. Well, since then, the camera has been developed where we can transmit the images from the scope onto a TV monitor, enabling myself as well as my team to see what I'm doing and to help assist the patient in their care. Through the arthroscope, we can do many surgeries. This shoulder, you can do rotator cuff surgery, you can do labral surgery, and you can also do stabilization surgeries. For the knee, you can do meniscus surgery, you can do cartilage surgeries, and you can also do ligament surgeries such as anterior cruciate ligament or ACL reconstruction surgeries. This enables the patient to have as little pain as possible by making the smallest incision and collateral damage as possible to do the surgery. It makes rehab easier and less painful and typically more rapid compared to the more traditional open surgeries. The advent of the arthroscope has dramatically changed orthopedic surgery, and since the 1990s has led to a shift of nearly all possible surgeries to become arthroscopic. There are some surgeries still that cannot be done with the arthroscope when implants are introduced that are too big for the incisions. We have specialized implants, such as anchors and screws that go through these small incisions to do the surgery, as well as shavers and other instruments to enable us to do the surgery. By having less pain and a quicker rehabilitation, the patient's more comfortable and can get back to activities much more quickly. The traditional open surgeries led to more pain and a higher complication rate as well. The complication rate from arthroscopic surgery for infection, for example, is a fraction of what it is for open surgery. This is our demonstration patient, and this is his knee. This is his toes, and his body's up here. This is the kneecap, or the patella, and the incision for an arthroscopic knee surgery is just below into the sides of the kneecap, here and here. Those are actual incisions, less than 1 centimeter in length, and those are the incisions we use to introduce the arthroscope instruments through the skin into the joint, enabling us to look at all compartments of the knee. Meniscus surgery, although repair is also a surgical option, the majority of tears are debrided or removed to give pain relief. There's a spectrum of cartilage surgeries that can be done for cartilage damage on the ends of the bones. That cartilage is called articular cartilage. Finally, an ACL or anterior cruciate ligament reconstruction can also be done through the arthroscope. Now, we'd start with these incisions. We would make one more incision on the side of the tibia for an allograft surgery to pass the graft. There are 2 types of graft: allograft, which comes from a cadaver, and autograft, which comes from the patient. It's a personal decision by the patient as to which graft they would choose. I will now demonstrate some of the incisions for shoulder arthroscopy. This is our demonstration patient. Typically, there are 2 ways of doing the surgery. I do it in what's called the lateral decubitus position, or the patient lying on their side. The shoulder's here, the patient's hand is here, and his head is here. There's a traction device placed on the end of the bed that pulls about 15 pounds of traction on the arm to create a space to place the scope into in the shoulder. For that reason, the patient typically has to be asleep in order to enable them to stand still and have that traction placed for the half an hour to hour of the surgery. The incisions are the following. I've already drawn out some of the surface anatomy of the bone called the acromion. There's typically one incision placed in the back of the shoulder about that size, and one incision placed on the side of the shoulder, and one more in the front of the shoulder. Through those small incisions, we then place the arthroscopic cannula into the shoulder and also have other instruments to use for working portals. We can place a probe or a shaver into the same area and do all of the work for the surgery. That also includes arthroscopic rotator cuff repair with an extra small incision here can place in the anchor for repair. This enables us to do arthroscopic surgery, minimizing the pain and collateral damage to the patient. These small incisions cause very little pain, and most patients have very little pain after the first week from surgery. The highest level of training for sports medicine and arthroscopy is having a board-certified fellowship training year, being board-certified in orthopedics, and being board-certified for sports medicine. I have all those accomplishments, and I hope to be able to use those skills and experience to care for you as a patient.